Good morning, everybody. So today's topic is going to be on the influenza virus, and I mainly want to focus on prevention of the virus, but I do want to talk about the flu shot first. I'm going to start by discussing that. And this is really just educational for you so that you can make an informed decision as to whether or not taking the flu shot is right for you and your family. This is in no way to try and persuade you one way or another. It's just really to kind of give you the facts for you to be able to be your own healthcare advocate, and then also discuss it with your healthcare provider so that, again, you can make the best decision for you and your family. So a couple of things about the flu shot. And I made some notes as I was looking at what I wanted to discuss so I wouldn't forget anything. So who is recommended to get the flu shot? Well, in 2010, the CDC changed their recommendations to universal recommendations, meaning that anyone 6 months of age and older should receive the flu vaccination. That is their recommendation. Now, they further break that down into high-risk categories, and I'll discuss those in just a minute, but what's interesting is you may wonder, why do we have to take this vaccination every year? Well, each year, the different strains of the influenza virus that are out there and circulating vary, right? So the way that they formulate the vaccination is by looking at research and coming up with the most common strains. And so what they'll do is they will then formulate the vaccination based on what they predict to be the most common strains for that upcoming season. So, it's a guess, but it's based on research. So that's how they come up with the flu vaccination and why it's recommended that you take it yearly and it's not just a one-time thing. The other thing about that is that over time, viruses mutate. So they change and they mutate, and so if you were vaccinated against that at one time, then the vaccination may not be effective if that virus over time has changed and mutated. So that's something interesting that sometimes people aren't aware of. But those high-risk categories that there's a stronger recommendation for the vaccination are in children. So children under the age of 5, but specifically under the age of 2, are considered at highest risk. And then older individuals, 65 years of age and older, are a high-risk category. People with chronic health conditions, things like asthma, heart disease, diabetes, kidney disease, liver disease, any kind of chronic health condition, pregnant women, and then lastly, those who are residents of a nursing home or a long-term care facility. Those are considered high-risk individuals. Now, somebody put a comment earlier about the fact that they're a healthcare provider and that they are required to take the flu shot, which is the case in most institutions, especially large institutions, hospitals, because if you are a healthcare worker and you do end up contracting the flu, then of course you can expose other people who have weakened immune systems to that. However, some people aren't aware of this, but you can actually sign a waiver saying that you are refusing to get the flu. You choose not to get the flu vaccination, but most hospitals are going to require that their workers wear a mask anytime that they're in the hospital if they do choose not to get the flu vaccination. So again, that's another choice that you have to make individually for yourself. But those are really the recommendations by the CDC for who should get the flu vaccination. Now, those in the holistic health community that choose not to get the flu vaccination, it's typically because we're concerned about other things that may be in the vaccination, right? Things like fillers, heavy metals, and what long-term effects that could potentially have on your body. The other thing is, if it does not cover all strains of the virus, then you could potentially still get one strain of the virus even though you were vaccinated and you in turn exposed your body to more chemicals and toxins. So that's probably the reason that most people choose not to have the flu vaccination. Now, I will say there is some misconception on the fact that people will often say, well, you know, I got that flu shot and it gave me the flu. It made me have the flu. That's not possible with an injection, with a shot, with the flu shot. It is not a live virus, so that it cannot actually cause you to have the flu. Now, the mist is a live virus, but it is a weakened form of that virus. So just to kind of clear that up, I know that that's always a question. I see lots of patients that will say that, you know, that they got the flu shot and that it caused them to have the flu. So just wanted to clear that up. Now, the rest of the discussion, I really want to focus on ways that we can prevent the flu. Because whether or not you choose to get the shot, that's again a personal choice. Whether or not you choose to get it, you can still incorporate all of these things that I'm going to discuss to prevent you from getting it. So the first thing, as you can imagine, I'm going to kind of break this down into mainly dietary changes and then also supplementation, things that you may want to start to incorporate. So with dietary changes, you know, one of the biggest things is what we put into our body, what we feed our body, and that really affects our immune system and how well we are able to fight off things like the flu. So one thing that you can do is ingest garlic every day. So garlic has lots of antimicrobial properties and anti-inflammatory properties. Now, the best way to incorporate that into your diet is in the raw form. So ways to do that. Now, you know, there are certainly garlic tablets that you can take. You see them at health food stores, but the best way to get that, a daily dose of that, is in raw form. So when you want to do that, things like salad dressings, including a little bit of raw garlic in a salad dressing or in some type of dip like a hummus or something that you would dip vegetables in, would be two great ways to incorporate raw garlic into your diet. The next thing that I think that people are aware of and hear a lot about is ginger. Ginger is such a great thing. It has tons of anti-inflammatory properties, and it also has antiviral properties. Some people don't know that about ginger, but it does have antiviral properties. Now, the ways that I use ginger daily, and I would say probably 4 days out of the week, I consume raw ginger. Now, that's just kind of an average of what I'm able to do each week. But if you can do that daily, that's even better. So the two ways that I like to incorporate ginger are first in a detox tea that I make and drink sometimes in the morning. And what that includes is just some hot water. Then I put a little bit of apple cider vinegar in that, cayenne pepper, and then you could either squeeze fresh lemon and put fresh ginger in that, or what I like to do is use my essential oils. I'll put 1 drop of lemon essential oil and 1 drop of ginger essential oil in that and drink that in the mornings before I've had anything to eat. And that's a really good detox, but then I'm also getting those added benefits of the ginger. I'm getting the anti-inflammatory benefits and the antiviral benefits. So that's way number one. Number two, the other way that I love to incorporate ginger is in a smoothie. So when I make like a tropical smoothie, I'll take some ginger and just take about 1 inch of fresh ginger, readily available in all grocery stores. And I'll put that into the blender with typically coconut milk or coconut water, some spinach, and then I'll typically use tropical fruit. So I'll use something like pineapple, mango, I'll use some banana, maybe some strawberries, and then blend that up, and it's delicious. The ginger gives it a little bit of spice and heat that you can feel a little bit in your throat, and it's just tastes delicious. So those are two ways to incorporate raw ginger into your diet. Now, cooking these foods like garlic and ginger are also good, but again, you get the most benefit and retention of the nutrients from the raw form of those. For instance, last night I cooked chicken lettuce wraps and some cauliflower rice. And I included ginger and garlic in that, which again gives me some health benefits, but raw form is best. Okay, so now I'm going to move on to, well, before I move on to supplements, actually, I want to mention what is probably if you don't take away anything else from this today, if you can change this one thing, it will be huge, not only for preventing you from getting sick this winter, but just overall health. And that is to kick the sugar habit. And that's probably the hardest for most of us to do. So sugar is hidden in everything, right? You go to the store, you look, somebody even was telling me the other day that they were looking at a can of, I think it was pinto beans, and it had added sugar. For what? You know, what would be the purpose of that? I'm not sure. But sugar is hidden in everything. So you want to make sure that you are cutting out as much of that as you possibly can, and start, with small baby steps and shifting in the right direction. Making those small changes over time is what will last you. You'll have those lasting habits, and you'll see real progress. But getting your kind of sugar fix from natural forms of sugar, from fruit, from sweet root vegetables like sweet potatoes, butternut squash, that kind of thing is where you really want to get your natural sugars from. You want to avoid any kind of processed, refined sugar. White sugar is terrible for our bodies. Things like processed foods, sodas, that's a big one for a lot of people, is cutting out the soda consumption. Now, the reason that sugar is so terrible for our bodies is it turns on inflammation in your body. Okay, so the more sugar that you consume, the refined sugars, processed sugars, your body is in a constant state of inflammation. And we know that most diseases start with inflammation. So you could decrease your chance for things like heart disease, diabetes, just by cutting out and eliminating some of those processed and refined sugars. The other thing that having this high sugar content does is it weakens your immune system. So your immune system is going to be weak. You're not going to be able to fight off any viruses or bacteria that you come in contact with. And let's face it, we can't avoid coming in contact with whether it's the influenza virus or, something else, unless you live in your house, never leave, never invite anyone else in, then you just can't avoid it. Whether it's your kids are bringing things home, it's at a restaurant, at the grocery store, at work, you're going to be exposed to these things. So the more we can sort of dial up and amp up our immune system, then the better off we're going to be. We're going to be able to fight off these things that are coming at us. So if you don't take anything away from this today, please try to cut back and eliminate some of the sugar in your diet. So now I'm going to move on to supplements. Now, some of these supplements are things that you should include on a daily and yearly basis, every day of the year. And then some are things that you might just want to consider amping up or incorporating during the kind of cold and flu season. So the first one is probiotics. You have probably heard us talk a lot about gut health. And if you don't have good gut health, then you're not going to have good immunity, because 80% of your immunity lives in your gut, okay? So our gut needs healthy bacteria, aka probiotics, to help us fight off those things that we're exposed to. Now, you can certainly get probiotics from different foods, so things like yogurt, fermented foods are great. Things like fermented vegetables, kombucha, kefir, those things are great for probiotics. but you're probably not going to get the amount and the level that you need if you're not taking a daily supplement. So I recommend everyone take a daily probiotic. Now, I like to use, what I use myself is doTERRA's probiotics, but there are lots of good brands out there. You just want to make sure that you are getting them from a reputable source. And also, there are a couple of different kinds. You can get probiotics that you probably have seen that require refrigeration, right? Because to keep those strains alive, they have to be in a cool environment. And then you have some that don't have to be refrigerated, that are typically encapsulated so that those probiotics stay live and don't get destroyed right when they get into your gut from all the acid. So those that are double encapsulated, actually, when you ingest them, they pass through the stomach and go into the intestines before they're broken down and the probiotics are actually released, because that's really where you want to get the probiotics is to the intestinal tract. So that's what I prefer, and that's what doTERRA's are. They are double encapsulated and they don't require refrigeration. So that's just kind of an FYI. But definitely I would encourage you to take a probiotic, not just during the cold and flu season, but every day of the year. The next supplement is vitamin C. Now, most of us, I see people all the time that are taking vitamin C just because they hear that it's healthy, that it will prevent them from getting sick, and there is definite truth to that. So consuming vitamin C, I do this on a yearly basis, but sometimes I'll amp it up a little bit during the cold and flu season. So a couple things with vitamin C. It provides great immune support, and it also has antioxidant properties. So boost your immune system. And it helps get rid of some of the oxidative stress that our bodies are exposed to on a daily basis. I typically take 1,000 milligrams of vitamin C per day. The recommended dose is anywhere between 2,000 and 4,000, okay? I take 1,000 because I consume lots of foods that are naturally high in vitamin C. But if you're somebody who maybe doesn't consume those type foods, then you might want to consider 2,000 to 4,000 milligrams. Now, as far as the foods that you can get that are high in, that you incorporate that are high in vitamin C, green leafy vegetables. So kale, spinach, broccoli, Brussels sprouts, those are all high in vitamin C. And then you're looking at your fruits and vegetables. So we all know oranges, right? We always think of oranges when we think of vitamin C, which is great. But there are actually lots of other fruits and vegetables that are even higher than oranges in vitamin C. Lemons have vitamin C. Kiwi fruit, I love to incorporate kiwi into like a mixed fruit salad. Just chop that up with other fruits. And my family loves that. They're always asking me to cut up and make a fruit salad. And I always include kiwi in that. Sometimes I'll put kiwi into one of those tropical smoothies that I mentioned with the ginger. That's really delicious. Pineapple and mango also have vitamin C. Strawberries. And then one that actually has higher vitamin C than oranges are peppers. So red peppers, green peppers, yellow, so your bell peppers. What I like to do is cut those up into little strips and then eat them raw. Sometimes I'll dip them into a lemon tahini dressing. I think Carrie did a Facebook Live on how to make that recently. It's super simple, but that's a really delicious just snack to have that gives you a lot of vitamin C. So because I incorporate those things on a daily basis, I eat kale every morning. I saute kale and top it with an egg. And then I also eat spinach in my salads, and I put spinach in my smoothies. So I get lots of fruits and vegetables that are high in vitamin C. So I choose to only take 1,000 milligrams of vitamin C. But again, you can do 2,000 to 4,000 milligrams. Now, the next supplement that The next, actually, two supplements that I'm going to discuss are ones that I only take during cold and flu season. The first one is vitamin D, vitamin D3. So you probably are aware that the way that we get most of our vitamin D is through sunlight exposure. When sunlight hits the skin, it converts into vitamin D. It causes your body to produce vitamin D. So if you get 20 minutes of sunlight exposure per day, then that's a good dose of vitamin D. Now, that means that it has to be not through clothing or through sunblock, okay? So it does have to be direct skin exposure to get the benefit of the vitamin D. Some people are not able to convert, their bodies aren't able to convert that sunlight exposure into vitamin D as readily. And that's usually people who are overweight, and also those who have chronic inflammation in their body. So maybe people who have some type of chronic disease state, or just chronic inflammation, maybe from things that they are putting into their body or even exposed to on a daily basis. So those type people probably need vitamin D on a daily basis throughout the year, not just during cold and flu season. But what I like to do is, and I do this for the kids as well, I like to just get a vitamin D supplement, vitamin D3. I buy 1,000 IUs. It comes in international units, is how that's dosed. And I just get 1,000. They're little tiny pills. My kids are old enough to be able to swallow pills. It does come in liquid form, so you're able to get that in liquid form. And I should also mention that for kids, vitamin C comes in a liquid form. And what I do for my kids, I don't have them swallow a vitamin C supplement. It also comes in chewables. But vitamin C supplements tend to be a little bit bigger. The pills are a little bit bigger. So I use the liquid in their smoothies. So that's a way that I like to get added vitamin C into their diet. But back to the vitamin D. So I like to buy the 1,000 IUs, and we will all take one of those a day, okay? Now, there are foods that do have some vitamin D, and again, we incorporate some of these foods that I'm going to mention into our diet. So I feel like, we're getting some vitamin D there, and then also in the supplement. But I wrote down kind of what the recommendations were for different ages as far as how much vitamin D you actually need. So for infants, any child under 12, so this is under 12 months, under 12 months, it's 400 IUs is the recommended dose, but you can go up to 1,000. So you can actually go up to 1,000 IUs for a child under 12 months, an infant. And then from age 1 and up, it's 600 IUs per day up to 3,000. So you can actually go up to 3,000. So you can see, yes, in some cases, if you were consuming, lots of supplement, a large amount of IUs in a supplement, then you probably could get too much, but it's very rare that you would get too much vitamin D. And you know that you can have your levels of vitamin D checked. A normal range is considered about 20 to 50. Now, some references will say 30 to 50 or 60, but a good average range is 20 to 50. So lots of times you'll see that your healthcare provider might want to check that to see if it's something that you do need on a daily basis. So the foods, I mentioned that there are some foods that do have vitamin D. These are things like salmon, tuna, eggs, which we incorporate into our diet. Now, the amount of IUs is pretty small. I mean, it's like 10, 20. So it's not a ton of IUs of international units of vitamin D in those things, but we do incorporate those into our diet. And then you see a lot of milks and yogurts and orange juices that say they're fortified with vitamin D. So if you choose to consume, we don't really eat much dairy. I don't eat any dairy, and the kids don't eat much dairy or orange juice. So I don't typically consume the fortified vitamin D. I prefer to take the supplement. Now, one other way that we get vitamin D, and this is my next supplementation I want to talk about, is cod liver oil. So during the cold and flu season, the vitamin D and cod liver oil is something that I always give myself, my husband, the kids. We all take that during cold and flu season. And that is one of the things that has been shown to help prevent the flu. So as far as cod liver oil, it is a fat soluble vitamin, and then it also has EPA and DHA, so it has your good healthy fats in it, and it just is a good immune supporter. So it helps, again, to support a healthy immune system so that you can ward off anything that your body comes in contact with. So what I like to do for the cod liver oil, now you can get this in capsule form and you can take it in a capsule, but what I do that just kind of makes it easy for us is we incorporate it into smoothies. So, and you can't taste it. It does not taste. You keep it in the refrigerator. It doesn't have a fishy taste. And when it's blended into a smoothie, you can't taste it. So I'll use a teaspoon in each of our smoothies. Now, I did look this up to kind of see how much vitamin D was in that amount, because I couldn't remember. So in cod liver oil, 1 tablespoon has about 1,300 IUs, or international units. So there are 3 teaspoons in a tablespoon. So I would be getting about 400, a little over 400 IUs just in the cod liver oil. So that's a good combination, because it is, again, immune support, anti-inflammatory, to use the cod liver oil and the vitamin D. Those are the 2 biggest things that I add to our daily regimen during the cold and flu season. And then last but not least, this is not a supplement, but probably rates right up there with the sugar consumption and decreasing or eliminating that, and that is getting the proper amount of rest, which I know is so hard for so many of us because we're busy, we have things to do, we might put the kids to bed, and then, we've got to be up getting everything ready for the next day. But you really have to carve out that time to get that good 7 to 8 hours of restful sleep. Because what's happening during the day is your body is exposed to, all of these chemicals and toxins and stress, just the stress of daily living, that your cells are actually breaking down during the day. And the only way for your cells to recover and rejuvenate is rest. So that's why you'll see, when you're sick, right, or when you feel like you're getting sick, one of the biggest things that you can do is rest more, sleep. I mean, that's why sleep really helps us, when we're sick, to kind of recover. It's because our cells are able to rejuvenate during that time. So whatever you need to do to get that restful 7 to 8 hours of sleep, maybe it's making sure that you turn the TV off, or, get off of your phone 30 minutes to an hour before the set time that you want to go to bed. Maybe it's incorporating essential oils. I love to use essential oils at night to diffuse to help me get a restful night's sleep. And you can tell this too. I was just having a discussion with someone recently about how you can tell if your kids have gotten the proper amount of sleep. First of all, they're going to have stronger immune systems, so they're going to be able to fight off those, bacteria and viruses that they're constantly exposed to. But you can usually just tell by their attitudes, right? If they have not gotten, enough sleep and rest, then the attitudes usually aren't so great, right? So those are the top tips for flu prevention. Now, whether or not, again, you decided to take the flu shot, that's a personal decision, but I would just encourage you to incorporate some of those dietary changes and supplementation that we talked about so that you can have that really strong and healthy immune system so that you can prevent you and your family from getting anything that you're exposed to. Please leave any questions in the comments that you have, and I'll be happy to answer those. So I hope you guys have a great rest of the day. See you next time.